This is Dr. Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client has been very kind in letting me film her. And yesterday we treated her for a downslip pattern of the left hemipelvis, a right-on-right sacral torsion of the sacrum, and she also had a rotational fixation to the left of L3. And we treated all of those and restored normal position and normal mobility throughout the pelvis, except today she presents again with normal movement in all directions except when we have her lay on her right side. So this is the back of the body, the sacrum, okay? Sacroiliac joint is in here on both sides, all right? And when I have her lie on her side and I try and compress the ilium in the front, it feels like I'm trying to push a brick. There's no give whatsoever. And when I compress the back of the ilium, there is movement, there is give. And the opposite of that is true when she lies on her other side. So when she's laying on her left side facing the camera, this is right hemipelvis, right ilium, okay? Then when I come to the front of it, she has give, there's yield. I can take it the slack and spring it, and there is distinct movement. And when we come to the back of the ilium, there's no give. And this is a traditional inflare outflare pattern described in the osteopathic literature, which is really rare. I call it type 2 inflare outflare, and I have named another type of inflare outflare in which there's more of an anterior-posterior component. It's more obvious. But I don't want to compare the two right now. You can look up other YouTube videos of mine that describe the type 1 inflare outflare. Another way of evaluating this or suspecting this is to look at how the pelvis lays on the table. And you can find the ASIS, the bump in the front, and you put your thumb on the middle of it, and then you palpate the outside of the pelvic musculature. And you compare that to the same thing on the right. And what we found with Jennifer today is that the pelvis looks to be rotated to the left, because there's a wider mass on the right side. Now, I am not saying that this phenomenon happens in the SI joint. I'm saying we don't know. Okay? No one has studied this specific pattern in a population and then used the standard of orthopedic research, implanting titanium markers inside the sacrum and the ilium and testing passive movement. No one has done that, so we don't know that. It could simply be a nervous system muscle pattern twisting the pelvis somewhat and blocking motion in this manner. I'm happy with that description. I'm simply interested in normalizing muscle function, subtle movement throughout the pelvis. I'm interested in normalizing this, and based on yesterday's treatment, we have a separate case study on her, and she responded very well to reducing the downslip and the torsion of the sacrum, and she has a lot less burning. Average day pain was rated 6 to 7, and coming in this morning she rates it a 3, but no longer a burning, no longer a diffuse burning, primarily on the left side where my hand covers, but now is more of an ache. And I think this is a perfect time to treat the inflare outflare and then introduce gentle movement. So what I'm going to do is demonstrate the inflare outflare on her, and I think that'll be valuable. So let's have you now lie on your left side, facing away from me. And your head goes up at the other end. Yeah. And then roll on to the other side. My mistake. Lay on your right side. So I'm shooting the camera at an angle. Actually, I think I can do a pure lateral view. And now I identify the ASIS, and I capture with the palm of my hand the anterolateral aspect of the pelvis, and I stack my hands and I'm pushing straight towards the floor. Nothing's happening. I'm using a considerable amount of force and there's no give. Now please note that her legs are straight, or in slight extension, just a little bit of extension. When I come back and find the PSIS, and then I capture ilium above and below the PSIS with my